As I've mentioned before, we've added all syringes to the syringe selection page. So if this were just one syringe type, say BD was the only type, then monoject and BD would both appear down here in all syringes. So that if there were some situation where there was a back order or the syringe wasn't available for them, they could pick it from all syringes. In the current situation, BD and monoject are the only parenteral syringes for the North America launch. As we progress and mature, we may have other syringes to add. But for now, BD is the syringe that I'm going to select. We're going to always have the screen to confirm what it is, and we're also going to have this messaging that says that the incorrect brand or size may lead to harm. We want to make sure that the user understands they need to make sure what they've loaded matches what the screen says, because that's what this pump thinks has been loaded. So I'm going to say yes. Priming with the pump. So again, users typically will prime manually before they load the syringe, and priming with the pump is always important to reduce startup time. But keep in mind on any infusion that is time-based, the startup time, although important, isn't as important as getting the entire dose in the programmed time. So although we want nurses to always be in the practice of priming with the pump, if they choose not to on an amount over time or a volume over time infusion, it's not as critical. We always will show this screen though, when it's an amount over time or a volume over time infusion. We also remind them that not priming with the pump may result in delays in infusion. So when you're demonstrating, I would recommend that you still demonstrate priming with the pump. So I would say yes, confirm I'm not connected, and then press and hold that prime button. Again, if they've pre-primed manually, it only takes a moment to get just a drop of fluid out the end of your set. I'm going to say complete, and then I'm going to select my drug. And so for the purposes of this demonstration, and I recommend for your demonstration as well, I'm going to use the cefotaxime. So I'm going to select cefotaxime and press OK. The 100 milligrams per ml. Confirm my medication. Okay. Now remember that when we're entering a weight-based amount over time infusion, when it asks for the amount, it wants the total amount. In other words, the dose per kilo. So my total amount I'm going to enter is 500 milligrams. My weight, because this is pediatrics, I'm going to use a 10 kilo patient. And then, of course, we enter my weight. Keep in mind that pediatric department encompasses tiny patients all the way up to adult-sized patients. So you might have a neonate-sized patient here who maybe went home, came back with some sort of rhinovirus or something that they're going to need, or RSV, they're going to need some antibiotics for. I'm going to enter my time. Now, typically this medication is delivered over 30 minutes, but because I know that cefotaxime is set up in this library that with a very, very low delivery time, I chose this drug. I'm just going to enter 1 minute. You want to be sure you tell your user that they would be able to program the appropriate time, but this is for demonstration only. Press OK on my 1 minute. I'm going to get the soft limit because this is set with a 15 minutes lower soft limit, but I'm going to go ahead and accept it. Now you'll notice that everything is set up. My cefotaxime is red because I have that soft limit for time, and my rate is 300 mLs per hour. So I'm going to start my infusion. Now, a few words about flush. So when this infusion is complete, the syringe may be empty. I've got extra in this particular syringe, but the syringe may be empty, but definitely the infusion will be complete. But the line still has medication in it that is important to be delivered to the patient in order to complete their dose. So what's going to happen is we're going to get an infusion complete screen where the pump will stop, and we'll have an opportunity to set up a flush. I mentioned in the past that flush is typically a normal saline. Either a 3, 5, or 10 ml syringe usually is loaded, and typically the flush volume is 2 times the priming volume of and any additional add-on items, okay? Sometimes on a very small patient, they may want to make sure that that flush volume is less. Some places have a standard flush volume. They always flush with 2 mLs, or they always flush with 1 ml. So the flush volume will vary. So now my infusion is complete. I silenced my alarm. I'm going to select the line flush soft key. It asks me, do I want to deliver the remaining drug in the line? I'm going to say yes. And then I need to unload my medication syringe and then reload with my flush syringe. So I would connect my flush syringe to my line and load it. Now I have a new syringe, so I have to go back and identify that it is correct. And then it asks me, do I want to deliver the flush at the same rate? In pediatrics, usually the volumes are high enough that you are fine delivering at the same rate. If they've got a tiny, tiny patient where the medication volume was less than the volume of the flush, then delivering at the same rate may take longer than the medication was delivered. So in that case, users may set up instead of the flush as a volume over time, and I will demonstrate that in a moment. But for now, we're going to say yes, we do want to deliver flush at the same rate. Okay, so the volume I'm going to deliver is going to be 2 mLs. You'll notice it calculates my time. It's just 24 seconds, but it keeps my rate of 300 mLs. Okay, and I go ahead and I deliver my flush. When my line is flushing, my arrows are blue, and the fluid in my syringe is also blue. Okay, so that's flushing at the same rate. So now I wanted to demonstrate how the user would program a flush that they did not want to run at the same rate as the medication. All the user needs to do is select no when they get to this screen, enter the volume, and then enter their time. And notice the time is in minutes and seconds. So for 15 seconds, they would enter 15 and press OK. Pump automatically calculates out the rate. Notice it is different from the 300 mils per hour that was programmed for the medication. Sometimes what users will do is they'll deliver the medication over, say, half the time, so maybe over 15 minutes, and then they'll set up a flush for 15 minutes, and that way the total infusion is complete in 30 minutes. This way they can program that volume over whatever time they want. And then they just go ahead and press run. You'll notice that there are the blue arrows and blue fluid in the syringe.